Welcome back to Jersey Matters. I'm Larry Mendte. At Governor Murphy's COVID-19 briefings, you will hear him say he makes decisions on lockdowns and restrictions based on what the doctors and the scientists have to say. One of the doctors the governor listens to, we spoke to this week. Here is Dr. Edward Lifshitz, the director of communicable diseases at the New Jersey Department of Health. Doctor, thanks so much for agreeing to do this. We really appreciate your time. I know it's a busy time for you. We keep hearing we're just at the beginning of this second wave, that it's going to get worse. How bad for New Jersey? Do you forecast that?
Well, as Yogi Berra once said, predictions are difficult, particularly about the future. So while we do have some general idea, and we do know that, yes, it's going to get worse before it gets better, exactly how bad it's going to get depends on a whole lot of different things. And one of the big things it depends upon is what everybody listening to this talk, everybody who listens to the news out there in New Jersey does, because it's really our actions that will really impact what happens throughout the state of New Jersey. And the better that we do as far as reacting to this, the better it will be for New Jersey.
When they make policy about restrictions, when they make policy about the pandemic, what is your role exactly?
Well, as medical director in the Communicable Disease Service, we work with other people within the Department of Health as well as the governor's office to provide the best information we can and to give the best guidance and advice that we can. So we're at the table and we help give the information, and we work together with those other parts of both the department and outside the department that help make the decisions.
Do you recommend policy? And I ask that only because these restrictions are not as strict, for lack of a better word, as in other states. And some of the neighboring states have gone much further than New Jersey has gone. Do you think that this is appropriate, and do you make policy recommendations?
We help make recommendations as well as other groups within New Jersey, so we're certainly not the only group that helps make those recommendations. As to the question about whether we have gone far enough or whether we will go further, time will tell. It's always this balancing act, and it's very difficult for anybody to make that final call between doing what we think will be best as far as stopping the outbreak and not doing too much harm in other ways, whether it be economic or social or all these other things that go into it. I mean, we all know the way to stop this pandemic. I mean, it could all be stopped if everybody was just to stay isolated for 2 weeks and not mix at all. But that is an extremely hard or impossible thing to do.
It's interesting you say 2 weeks, because there was recently a op-ed by one of the members of the president's task force who said 4 to 6 weeks would do it. You believe that if the state were to shut down for 2 weeks, that would be enough?
Well, no, and there's a difference between shutting down, there's a difference between the state, and there's a difference between the country. And when we know that the incubation period for this is 2 weeks, so that if you give everybody 2 weeks where they're separated, and here's where it becomes impossible to do. I mean, if everybody in the country were all separated for that period of time, then yes, you could stop it. Now, I do agree with what the editorial said, that when you're talking about all the other things that go into this, about how impossible it is to entirely strictly separate and do really what would be a super lockdown, a little bit longer period of time would certainly make a difference. We know certainly from New Jersey's experience back in the spring that the lockdown did help. I mean, it made a huge difference as far as flattening the curve.
I read an article recently on NJ.com that said New Jersey has some difficulty keeping up with the number of cases because there's a lot of testing going on and they don't get the numbers right away. Could you explain what's happening there?
Well, there are a bunch of different things that are going on, and there are different ways that testing is being done. The most common way that people think about testing being done is the PCR test. That's the test that's been around for a while, and that New Jersey is running somewhere in the neighborhood of roughly 40,000 tests or so a day. And those are the numbers that we report out every day as far as our positives. Now, the majority of those tests come back quickly within a matter of 2 to 3 days. However, some of them could take a longer period of time, 5 days, 6 days, sometimes even longer. And of course, the ones that take longer are an issue, because if you don't have those results in the system, you can't do contact tracing, you can't follow up on them in general. Now, in addition to that, as the numbers do increase, and we've gone, from 300 or 400 a day or less over the summer to 10 times that number now, In some areas, when you get that many positive results coming back, it is hard for the contact tracers to keep up with that. So while the state is working hard and the local health departments are working extremely hard at both increasing the number of contact tracers and putting them where they're needed the most, there are times where just the sheer numbers can cause a backlog as well.
I know you talked about other side effects, the economic problems and also health problems that can arise from having a lockdown, and I'm sure that plays into it. But how much of it is just lockdown and pandemic fatigue, that it's just not a popular thing to do anymore?
I know we're all tired of this. I don't like wearing a mask. I don't like not being able to see my family and friends in person. I sure don't like what this is doing to my family as far as my kids and their academic careers, their professional careers, their social lives, their athletics. I know what this is doing to the community. I don't like that at all as far as the economic effects, the businesses and the other problems. But what I really hate, more than anything, is I really hate thinking about the families of all those people who have died and will continue to die. New Jersey has put in an awful lot of effort. We've made an awful lot of sacrifices. Now's not the time to be giving up. Now's really the time to be pushing through, as the governor said, because help is coming. But it's not coming next week and it's not coming next month, and we need to get through these next several months.
Well, Sarah, I'll end it with that. Thank you so much for your time.
Thank you.
Dr. Edward Lifshitz, the Director of Communicable Diseases at the New Jersey Department of Health. Still to come, the greatest fear of small business owners in New Jersey is another lockdown. You'll hear from them next.